And I will talk about psoriasis and cancer, epidemiological associations. And first of all, my disclosures. And then I have a little agenda, and I will talk about the risk of cancer in patients with psoriasis, potential risk factor for patients with psoriasis, and a little bit about the risk of cancer in patients with psoriasis on biologics. One of the first major studies looking at cancer in patients with psoriasis was a study from US, including data from 3 states in US and more than 250,000 persons. And the authors were looking at the risk of cancer in patients with psoriasis compared to patients with hypertension. And they were able, due to systemic treatment or not, to separate the patient with psoriasis into patients with severe psoriasis and patients with less severe psoriasis. And they found that there was an increased risk of cancer clearly in patients with severe psoriasis, but not in patients with mild psoriasis. And that was in a way a start, and there has been a lot of studies looking at the risk of cancer in patients with psoriasis afterwards. And in 2013, the first large meta-analysis were published in JADV, and there was another following up from UK in JAMA Dermatology in 2019, where they perform a systematic review and a meta-analysis on the risk of developing cancer in patients with psoriasis and also the risk of dying of cancer. And they were able to include 50 studies with the incidence of cancer, 15 on reporting on cancer mortality, and 7 studies reporting on both. And what they found was that for all psoriasis, mild or moderate or severe, there was a small increase in cancer overall. If they look at studies only including patients with severe psoriasis, there was a little bit larger relative risk of getting cancer in patients with psoriasis compared to healthy controls. They then also look at which type of cancer did they found, and it's important to notice that many of the studies on the single cancers, there's only few studies, 1 to up to 7 for keratinocyte-derived cancer. So it's based on relatively few studies. But what they found was it was mainly squamous cell carcinoma, basal cell carcinoma, and lymphoma, but they also saw a little increase in esophagus cancer and liver cancer, but mainly the non-melanoma skin cancer and lymphoma. They also looked at the risk of dying of cancer, and there was only few studies. They were able to identify 3 studies looking at cancer overall, and they didn't find any increased risk. If they then look at studies with severe cancer, they were able to find 4 studies, and they found a little increase of risk of dying of cancer in patients with psoriasis compared to the background population. This meta-analysis was followed up by another one we performed 2 years later, also published in JAMA Dermatology, and we look at the prevalence of cancer and the relative risk of having cancer in patients with psoriasis. And we were able to identify 112 studies. We included both patients with psoriasis, but also patients with psoriasis arthritis. And we looked at the incidence and the prevalence. And in total, there was more than 2 million patients included. And what we found was a little bit repeating of the first, that if we looked at cancer overall, there was an increase in patients with psoriasis. If we looked at cancer without non-melanoma skin cancer, there was still an increased risk. If we looked at, of course, non-melanoma skin cancer, keratinocyte-derived cancer, there was clearly an increased risk. And beside that, we did found a small increase in risk in melanoma, in lymphoma overall, in also the separate as non-Hodgkin's lymphoma and non-Hodgkin's lymphoma. We saw an increase in lung cancer and in bladder cancer. And if we only look at patients with psoriasis arthritis, there was no overall increased risk, but there was only for one of the single cancer, namely breast cancer, that there was an increased risk. And what could be the explanation for this increase of cancer we see in patients with psoriasis? There are several possible explanations. One of them is the treatment we use for psoriasis. We use a lot of UV treatment, and especially we have used early on a lot of PUVA, and it clearly increased the risk for melanoma and non-melanoma skin cancer. We use some systemic treatment, which also increased the risk, as cyclosporine. And for early on, we, at least here in the Scandinavian continent, have used tar for psoriasis, probably also increased the risk of non-melanoma skin cancer. Besides that, the chronic low-grade inflammation that you see in psoriasis may also have an effect on the cancer risk and may increase the risk, especially for lymphoma. And this fits with that we see this increased risk of lymphoma in patients with psoriasis. Also, patients with psoriasis have several of the well-known cancer risk factors increased in patients with psoriasis, as obesity, increased smoking, drinking alcohol, and non-alcoholic fatty liver as a consequence of mainly obesity, but all that these risk factors are known risk factors for cancer and may increase the risk in patients with psoriasis. And the last thing is that patients, especially with severe psoriasis, are more often seen by doctors, and thereby it's more common that we will detect the cancer, and that's especially when they are seen by dermatologists. This may be the case for the non-melanoma skin cancer, but also due to our treatment, we take more blood samples, and by that identified the cancers. But what is then also the problem in the daily life? How do we treat this patient? And therefore, there has been a lot of focus on the treatment we use now, and especially for the severe cancer. And of course, people were worried about the biologics because they affect the immune system, and would they have an increased risk of cancer due to the treatment. And there has been some studies, not so many still, but there was a systematic review from UK, Pelava, looking at studies where patients have received biologics and the risk of cancer. And they were able to identified 8 studies, and they find an indication of a small increased risk of non-melanoma skin cancer. But they also said that there was few studies, and there was not so good studies, and with pure control groups. So we actually need more data We also, in the study from 2020, look at the risk of cancer in patients on biologic treatment, and we didn't find any increased risk for the overall cancer risk without keratinocyte cancer, or keratinocyte cancers alone. But we still need more data, and I'll just take a few studies with us. This is a study from Denmark from 2020, where the group has identified nearly 26,000 patients with inflammatory diseases, inflammatory bowel diseases, rheumatoid arthritis, but also psoriasis, and then seen whether the patient had a history of cancer, and then look at how many were on TNF-alpha treatment after they have had a cancer, and then identified 434 patients and matched them to 10 times as many patients, and then have a follow-up for nearly 6 years and look at the risk of a new cancer and the risk of recurrence of cancer. And when they look at overall both new cancers and the risk of recurrence, they couldn't see any difference in the patient on biologics, the red one, compared to the one who were not on biologics. And if they look only at the new cancers, neither any difference, and not at the recurrence, indicating that the TNF-alpha treatment didn't affect their risk of cancers. Of course, people are also interested in the more new biologics, and the first one here is 5 years following up of patient which has been treated with secukinumab in the clinical trials, where the authors collect all the clinical trials and look then at the incidence of cancers compared to the expected incidence, and there was no increased risk of cancer in the patient treated with secukinumab. And just a new published article in JAMA, looked at the risk in patients with the first anti-IL-23 guselkumab, and look at the risk of cancer in the patient treated for 5 years, and they looked every year compared to the expected risk in US, and there was no increased risk of cancers seen. So just to sum up, there's an increased risk of cancer overall. It's slight in patients with psoriasis, and it's especially keratinocyte cancer and lymphoma, and there's no overall increased risk in patients with psoriasis arthritis. The increased risk is most likely a combination of the chronic low-grade inflammation, but also the risk factors for cancer seen in patients with psoriasis, and then the treatment we use for psoriasis, and especially the more formal treatment. And the most well-known cancer risk factor we see an increase in patients with psoriasis is smoking, obesity, and alcohol. And there was no increased risk in cancer in the studies published until now with patients on biologics. Thank you.